Burnout, vulnerability, and shame. There are different points in our career where we do feel burnt out. And personally, for me, this is usually followed by feeling a bit of guilt that you felt burnt out and also shame. So that's the topic we're discussing today. And I have with me our clinical psychologist, someone who's helped me through going through this particular feeling and emotion. And I just want her here on the set us going through this. So welcome, Dr. Elizabeth.
Thank you so much.
How are you?
I'm fine, thank you.
Thank you for being here.
I appreciate too.
Awesome. Tell us about, I mean, I know you, but my audience doesn't know you. Who is Elizabeth, Dr. Elizabeth?
Okay. Dr. Elizabeth is a clinical psychologist. I love this work because it means working with the individuals who have different challenges. We don't call them problems, we call them different challenges because it is something that you can be able to deal with at your own levels. I specialize in the area of mental health, and mental health ranges from how we feel, how we think, to what we do, because our behavior is dictated by those two major areas, our thoughts and our feelings. And we do what we call individual counseling or therapy.
Yep.
We do group therapy. We work with families. Personally, I specialize with working with children. And the youth. I do mentorship programs for them, and also in alcohol and drug management.
Awesome.
So if you are out there and you feel you need somebody, here I am.
Yeah, and you're pretty good at those lines as well. You also have a clinic, right?
Yes, we have a center. We call it Safe Care Haven Treatment and Counseling Center along Kiabu Road, a few meters or about 2 or 3 kilometers from Kiabu Institute of Science and Technology. Both residential and outpatient services.
Awesome.
Yes.
Cool. And if you guys have watched my episode, I think that was my episode 1, where I was just very vulnerable and open with some of the challenges I faced. I went to Elizabeth because I really needed that support, and she talked about like the serenity prayer to me, and that's something I've always like held dear. So if you're struggling with your mental health and you need some support, she's definitely someone I recommend. So we're just gonna go straight into the topic. What is burnout?
Okay. I want to use a layman's language.
Yes.
Because at times when we use our technical terms, people are not able to get what we are talking about because not everybody has done psychology. And I would say that burnout, it is a state you find yourself in. It is not an illness.
Yeah.
It is not a condition, but a state of the body where you find that you are too tired, too exhausted, and it affects your emotions, affects your mind, and also your behavior. At the end of the day, you find that exhaustion or that feeling of weariness makes you more vulnerable to other issues. So we say it is a state of feeling exhausted. You have reached the end. If it is a workplace, it is the other chores we do like mothers or fathers. We are heading to the Father's Day.
Yeah.
So they feel so exhausted that they are not able to perform in their areas of work or even in their day-to-day activities.
Okay.
Yeah.
Interesting. I also kind of want to switch it to the context of Africa and Kenya specifically. I know sometimes we are not a people who complain like when we're burnt out. As you say, we feel exhausted. We always feel the need to get up and show that I can do this. I am strong. I might be tired. Is this something you've realized, because you have a lot of experience in the country and out of the country? Is this different like in Western society versus the African society?
Burnout is burnout wherever you are.
Yeah.
It is not culturally based. But the difference is what could be the triggers. That is where the difference lies. And also your cultural implications, because it has. If I take in the Kenyan context, and I take within the community, you find that women are more into burnout than men, because of the 101 chores they have to deal with all due respect, not ignoring the fact that even men do a lot of work. But I want to take this scenario where your mother, your father go to the shamba together, they go and work, come back home. The man, before you even open the door, he is asking where is food.
Where's my tea?
And you just come together from the shamba, and you are like, okay, even 1 minute break is not there. So you find that you have more on your table than what you can be able to meet, and it is a day in, day out kind of activity or experience, because the culture expects the woman to be the homemaker, the homekeeper. So you are running up and about, up and about. You find that the woman is the first to wake up and the last to sleep. You ensure that everybody is fed, you are the last to feed. If the food is not enough, you are the one who will take the remnants. So you will find that women experience burnout more in the African context than the men. Come to the other areas. Even in the workplaces, you'll find that people are experiencing burnout because of one reason or the other. But now this one is specific to work compared to the one that is specific to the community. So if you look at the African context, you find that the difference between the African context, the Asian context, or the European area is just the factors that contribute or make you more vulnerable to burnout than the other. Yes. So
in the work context, what makes a woman or like even a man like more vulnerable to burnout? What, from your experience?
I would look at the area of unresolved distress. I want to start with this person who is newly employed. You go to the workplace with a lot of enthusiasm. And you are so excited that from college you have gotten a job. You are so excited. Everybody at home is excited. You have gotten this particular job. And then it comes with its own demands. Your expectations, the family expectations, your social class changes, everything around you changes, and it brings in some levels of stress that you must meet these expectations and these demands. And then you go to a workplace where you find that you are doing all you can to achieve the set targets. Nobody appreciates. Or you are bullied in the first few months in the workplace, or labored. You realize that it brings your expectations down. You feel your needs are not met at all. So you lack support at the workplace. The work becomes even more than you had expected. You don't have support within the workplace. You become more vulnerable. So I want to look at this young man who is also lacking in the skills to cope with these challenges other than the work. So that person becomes more vulnerable. And I want to look at an example of bullying at the workplace. And bullying is not just physical. It can be emotional. It can be professional. It can be spiritual. If we look at the emotional bullying, is where people are also making comments, sarcastic comments when you pass or you raise a point. People become cynical, all these kind of things. And also where if it is the psychological support that you require to perform that work, they don't provide you. When it is professional, it is like where people are complaining their professional needs are not being met, you are not promoted, you are stagnating, you are doing the same job day in, day out, that one day, 30 days in a month, and Monday to Friday the same. It becomes monotonous. It is like a routine, a schedule you have to follow every day. It is not being appreciated. Look at the spiritual one. There are those people who have got their religious beliefs, and their beliefs and value systems are not respected. Like this person who would want to have his or her prayers at this particular time, and people think you are screaming or yelling. They deny you that opportunity to go and have communion with your supreme being.
Yeah.
This is spiritual bullying. Again, when your values and systems are interfered with, it also becomes spiritual, because spiritual is not just about religion.
Yeah.
For us, we take it as values and systems that you hold dear to you and help you to negotiate within your environment. And when you look at all that, they impact on a person significantly.
Yeah.
And when they start by creating stress in your system.
Yes.
But when this stress is not dealt with, it escalates and leads now to a level of exhaustion.
Okay.
Where you feel you can even throw in the towel. Some levels of stress you can be able to deal with, and the stress, we have two types. We have the positive and we have the negative.
Yeah.
Because like promotion comes with its positive stress, but where you are always intimidated and you are always underlooked by the system. That is, we call it distress.
Yeah.
And that is what we really focus on. And this one, if it is not handled, you are not able to cope, it leads to burnout.
Okay. Interesting. So how do I cope with stress? Because from what I'm understanding, the stress, if it accumulates, it leads to burnout. Mm-hmm. How do I cope with this stress?
The first thing is we call it self-awareness.
Self-awareness.
Know yourself.
Mm-hmm.
If you listen to your body, it says a lot.
Yeah, true.
Even before we go to a doctor, our body will give you a signal. For example, you may find that by 3 p.m. you are having a headache.
Yeah.
And it is Monday, Tuesday, Wednesday you're having that headache.
Yeah.
And what we do is to run to the chemist over the counter, you buy painkillers.
Yeah.
That headache is an indicator that something is not right within your system.
Yeah.
It could be your energy levels are down.
Yeah.
You have not taken your food. You have skipped your lunch.
Yeah.
And therefore your energy is down. Even if you take that medication, it won't go. Maybe we are not able to have that lunch break because we are working over lunch.
True.
So that could be one cause. The other one could be a signal that all is not well within your system. You could be having stomach upset.
Yeah.
And therefore, the presenting sign is headache.
Yeah.
So what are you supposed to do? When you have those headaches, it is you to listen to yourself and ask, what are the preceding activities or experiences? So before I have this headache.
Yeah.
And the moment you understand that, you'll be able to deal with the headache timely. Like you can have snack in between your meals, if it is the energy level that is down. There are those also who have a problem with sleep.
Yeah, yeah.
You ask yourself, for how long has it been there? What triggers that?
Yeah.
And then if it is the issues at workplace, you carry home because both workplace and home impact each other. You leave the workplace, issues at workplace, you leave them at workplace. You learn to come home and address the home issues.
Yeah.
And at times it is not very easy for this person because we are human beings and we are about to carry baggage from one side to the other. So again, learning how not to carry the baggage and transferring from one place to the other. That is very crucial. The other one is also listening to your own environment. Mm-hmm. Because your environment can speak to you. For instance, if you go to your office and you find that your table is disorganized, that says a lot.
Yeah.
It is telling you something. Yeah. You are looking for documents that you use it to arrange them very well. Now you cannot even locate where it is. It means something is not right. Okay. So you need to listen to yourself and deal with that one.
Awesome. I love that because I remember, when I saw you, this was a year ago, I think you can even tell I am a very different person. Like in terms of for me, it presented itself in I broke out in acne. I lost a lot of weight. Like you, I wasn't eating well. I just used to not sleeping. And it was for me to realize and be self-aware that actually these stresses in the work are detrimental to my health, and I need to make sure that I am dealing with it. So yeah, that was a good awakening that you gave me as well. So thank you. So now we've identified, we know the characteristics of burnout. What's next? Because I think it also comes with a lot of shame. Like for me personally, And maybe that's something I need to work out, to say like, actually, I'm actually very exhausted. I am very tired. I just need to take a pause on this, like deprioritize some things in my life. What does that look like? And why does it come with shame? Or is it just me?
Okay. If you look at now the stress, like what you said, it presents in a physical way, in an emotional way, and behavioral.
Yes.
If you take the physical, like what you have talked about, you find that the skin communicates about our health. Our internal health. What we are eating is what we present.
Yeah.
You are not able to sleep well, you are not able to feed well, so the body reacts in a certain way.
Yeah.
There are those who will present with acne.
Yes.
There are those who will present with rashes.
Yeah.
There are those who will present with lack of sleep. There are those who will present with a dry skin.
Yeah.
And until you deal with it from internally, you will not be able to deal with that.
Yeah.
And therefore, you have a problem because you'll feel very fatigued. Majority present with the tingling, that's with the itching. But when we come now to the emotional presentation, you find that you are very irritable.
Irritable, yeah, you
very
kind of
irritable.
can snap.
You are just snapping at literally, and even the wind. You are snapping.
Yeah.
Somebody knocks on your door, you snap. Your phone rings, you snap.
Yeah.
So that is an indicator that something is not right. You are not able to control and manage your emotions. Even when you are expressing your joy, you even become very cynical, very critical over everything. Now, before you now go to the behavior where you are banging tables and walking like, as I was getting into this compound, you can hear me 300 meters away because of the strength that I am using as I am walking. Others will turn to self-medication with alcohol and drugs.
Yes.
Others will get into other risky behaviors, and you'll find that people who are not promiscuous, they become promiscuous.
Interesting.
This is a way to deal with the challenges that we are having, because that is the only satisfaction that they are able to get to calm themselves. Now, look at all these things. They are not dealt with. They escalate.
Yeah.
And one indicator that you have burnout and not stress is the day you wake up, and we mentioned self-care, you feel like collapsing. You don't have any energy to go to that workplace.
Yeah.
You wake up and you see it is 7.
You're still in bed.
Your body refuses to wake up.
Yeah.
You have no energy. A mention of your workplace or the location where your office is just enough trigger to shut down your system. The other one is that it affects your whole setting.
Yeah.
You are not able to think straight, making decisions. Even solving problems becomes an issue. And one of them is forgetfulness.
Yeah.
Not the one that that goes with age, because with age we allow them. But at our age, you find that forgetting has become a major issue for you. Then that one is not that is a good sign. Targets you are not meeting. You have become very unproductive.
Yeah.
You are not meeting deadlines. You are at conflict with everybody and you hate everybody.
Yeah.
With that now, everybody start pointing fingers at you.
Yeah.
You ask yourself, I performed very well at my university level. I have been a performer previously. Now I am going down. You start feeling ashamed.
Yeah, there's a shame that comes
now
with that.
Shame comes with that. And you are no longer able to face the people. You are getting letters, you don't want to face the people at home.
Yeah.
You are getting a show cause letter, you don't want to face your colleagues. That shame is enough to also now make the situation worse. And the other issue that can bring shame is the cause of your problems. Like we have so many factors that lead to burnout. And if you look at the family issues that we carry with us and we carry them to the workplaces, you don't want anybody to talk about families because the mention brings you down.
Yeah.
You are so ashamed of saying who you are and what you are going through. So all these are factors that surround burnout. And you can even imagine somebody shutting down within the workplace, and maybe you are holding a senior position.
Yeah.
That presentation is enough to make you ashamed in presence of your juniors or your colleagues, and you don't want to face them tomorrow. So whenever they start now mentioning issues of mental health, you feel like they are talking about
you.
You don't want to go that direction.
Okay.
Yeah.
Interesting. And then I guess for me, like just going through the motions, you feel shame. And then next you feel very vulnerable. Like there's a sense of like, I feel like I've been wide opened and everyone can see through me and see that I am not this perfect leader or person and competent. And what do you do with that? Do you say, come in and tell someone, actually, I am burning out and I need time off? Is that what the recommended route to deal with burnout and shame that comes with it?
The first thing, the other thing we need to realize about burnout, it also makes you very paranoid.
Oh yeah, true.
Just what you have said is an issue of paranoia.
Yeah.
Where you feel like everybody can see your nakedness.
Yes.
And everybody knows what you are going through.
Yeah.
So you don't even want to face them.
Yeah.
Then you don't know what to do with your, if you are supervising people, you feel like when they are seated, the two of them talking, they are talking about my issues.
Yeah.
So you become so paranoid that it becomes now another dissembling issue. And you are always on your toes.
Yeah.
Always alert. It is like somebody sitting on a time bomb. The good thing is that burnout, you don't need medication.
Yeah, sure.
And if you go to the labor laws, they recommend breaks.
Yeah.
You work 40 hours, and that 40 hours, if you work for 8 hours in a day, that means you work 5 days, you have rest for 2 days. It is to rejuvenate.
Yeah.
And any employer who does not respect that is intervening on your
mental health,
on your rights. Then
right.
there is the issue of leave.
Yeah.
The 28 or 30-day leave. Unfortunately, we have people who don't go for leave.
Yeah, true.
Why? Because they wanted to compensate with, they get payment. If I work on my leave days, I am paid more, either double or some extra coins during my leave time. So they don't go for leave. They are a problem to themselves.
Yeah.
And that's why recently there is no carrying forward of leave days to the next year. There is no compensation for your leave days. If you don't take your leave days for this year ending in June, according to the government, it means you forego those days.
Yeah.
It is mandatory because your body is just like a machine. If you drive your vehicle for a period of time, a certain mileage, you take it for servicing.
Yeah.
Your body goes for servicing by taking a break.
Yeah.
So the first thing you need to do is to take a break.
Take a break.
And the human resource or human capital office is charged with this. If they realize a person has burnout or is stressed out, you seek for off days.
Yeah.
And it is deducted from your leave days. They should allow that because you are just taking care of yourself. Can you imagine being in a department where you are 5 of you, 1 with stress, 2 with stress, 3 with burnout? That department becomes very unproductive.
Yeah.
And who will have more work? Not the persons alone, but even the supervisor.
Yeah.
You make your work worse. So the issue here is allow your staff to go for break. If the break is not enough and they ask for sick off, please do that. Not sick off, time off, please do give them because they need to have a break. There's a day you wake up and you feel, I don't want to do anything. I even want to go to the washroom, but with my eyes closed. I want them closed. That tells you how tired you are.
Yeah.
You need to go to take that break. So it is very, very important.
Yeah.
Yes.
So for you, the first thing, you have burnout, take a break.
Yes.
Okay.
When you take this break, what do? This is not the time that you from Mount Kenya, you go to prune tea, to prune coffee, to plant your cabbages. It is your time to rest. You can imagine somebody coming from that hyped environment. You go and hype again yourself down there. You have not rested. Take a break from all work. Rest. The other one is the issue of nutrition.
Yes.
Check what you eat.
Yeah.
We have become the microwave family that we come with ready-made food, so we just warm it and eat.
Yeah.
What kind of food are you taking into your system? Because your presentation is based on what you eat.
Yeah.
So you have to eat healthy. And eating healthy doesn't mean you go to a 5-star hotel.
Yeah.
Your 5-star hotel is in your house.
Yeah.
What do you take? And you find that there's one area we ignore, issues of dehydration. And a person with burnout gets dehydrated very easily. So your fluid intake is very, very important. Your vegetable intake, your fruit intake is very, very crucial. So again, you look at yourself and ask, how well am I feeding? The other one is sleep.
Yeah.
Going on leave doesn't mean that is the time you sit to watch a movie day in, day out. You also give yourself a break from that. Unless you are watching a movie or listening to music that will calm your system, because music is also therapeutic.
Yes.
You don't choose the one that tells your body now to hype your body again. But something that will calm your nerves and help you to sleep.
Yeah.
Because the kind of movies we watch also dictate how we sleep.
Yeah.
How peaceful our sleep is.
Yeah.
So that is the other thing you look at. And then the social support that you have.
True.
Somebody says you are a presentation of the people you surround yourself with.
Yeah.
If you surround yourself with negative people, for example, negative people, cynical, critical, you are not better than them.
Yeah.
They even make you tired because you are using a lot of negative energy.
Yeah, true. And everything's
like now, within this period, you'll find a lot of negativity. And you'll find even when we go home, we are still talking with that negativity. We go to workplace, it is that negativity. But let us get out of this campaign season and ask ourselves from September, where shall we be? And you find that you are still with that kind of negativity. Something is not right with you. You need to deal with it. So look for positive people. Surround yourself with the positive people who can encourage you and people who are very honest. They can tell you, Wangari, you need a break.
Yeah.
And take a break. Mm-hmm. That they can even go to your employer and say, this lady needs a break.
Yeah.
Can she take a break? Other than having a friend who sugarcoats, yeah, you'll make it, you'll do it, you are not a professional. Yeah. Can we stop seeking support from those people who are not going to support? Then the other thing is that there is the behavior of self-medication. Can we stop self-medication?
Yeah, so the alcohol and the drugs.
Yes, you first start with over-the-counter, I am not sleeping.
Oh,
you abuse Piriton, cetirizine, serostamine, because they induce sleep. You find that even that...
Melatonin.
All of them.
Yeah.
Then you graduate to alcohol and other drugs. You calm your nerves. Somebody will tell me, I feel so good when I am stressed. If I take this, I am able to balance. You can continue balancing, but you are telling your brain, never think, never balance yourself. When you reach here, use me. So you make the situation worse for yourself. So avoid self-medication and avoid turning into other risky behavior. And the risky behavior is what I have said, alcohol and drug use and being promiscuous. Because many a times you find that is what we do. For women, when they have burnout, they shut down.
Yeah.
For men, they are more expressive. That is why you find men more into alcohol and drugs and promiscuous behavior. Women, we get into depression. That's why you need to see a professional. When everything is not working, please see a professional who can guide you, who can tell you this is where we are, let's explore what you have been doing and remove what is not working and see what we can use, what we can try to see that it will work for you. So, and that is an area that we ignore because burnout is an issue of mental health.
Mental health. Yeah.
Yes.
Awesome. I really love that. I think that was kind of what we needed to cover around burnout. Do you think there's anything you wanted to add on this topic around vulnerability, shame, workplace?
I would start with talking about shame.
Yeah.
Shame is us who feel it.
Yeah.
And it is based on the way we evaluate a situation. Mm-hmm. Work on your coping skills.
Yeah.
Because right now, I want to use this example of we are coming close to our elections in August. I want to take the people who will lose. How do they take that? Do they have the skills to even the person to accept that yes, I lost, and I lost genuinely.
Yeah.
Because we have people who don't have the two words, winning and losing, yes and no. And these people have a challenge because they are not able to evaluate the issue objectively. They are very subjective in their evaluation. So how do you take that defeat? How do you take that loss? If you don't have the skills to deal with the loss, you turn to other things, and it will bring your system down. And the other thing is that when you are stressed or when you have burnout, it is not an individual issue. Even the people around you, they are stressed, they are burnt out because they are tired of dealing with you. Even your colleagues at workplace are tired of doing your work and covering in for you. So I would say, first of all, evaluate your skills, your ability to cope. Not to go and hate back at people, not to go back and hate at yourself, because why they feel shame is because they have internalized and evaluated themselves as a failure. So you are ashamed of yourself. And this is the time we say, wake up and go. Dust your clothes and wake up. Yeah. You are not the first one. You are not neither going to be the last. We shall have people with the burnout day in, day out, so long as we are not able to evaluate our skills and our ability to deal with issues at home and in the workplace and within our environment. So your shame is yours alone, and it is made worse by how you evaluate it. And it becomes even very challenging for us as professionals, because we are not able to give you the coping skill because we cannot teach you. The other one is that when you now deal with shame, you create a stigma for yourself.
So let's talk about that more.
So stigma is when you are being treated in relation to what you are going through or your shortcoming.
Yes, I see.
For instance, we have a person who has been using alcohol and drugs in the workplace, and he goes for treatment. He is in recovery. We label them
alcoholic.
There's alcoholic, and in Swahili we say niule mlevi. So you have to differentiate me from the issue
behavior.
So if you are able to deal with the behavior and treat me with dignity, you are not going to create any stigma for the person. No. But when you now me and the behavior is like we are one. I feel you stigmatize the person.
Yeah.
And therefore we need to work on that so that we don't lead to stigma at the workplace. And when I was seated there, I was just reading something on the internet that, with all due respect, I won't name the area. They say that this kind of government, you know, the way we have lined up for these political positions, there is one that has sidelined women. And I got keen, I checked, and they said that women are supposed to be in the kitchen and changing diaper.
Allah.
That is stigma.
Yeah.
That statement itself is stigmatizing to a woman.
Yeah.
It is just like where you have, if you look at the gender, we call it gender what? Mainstreaming. They say that 30% of each. If it is majority are men, you make sure that 30% of the employees are women.
Yeah.
Or even it is a women-dominated, 30% of them should be men.
Yeah.
And you find that if it is not done, you are dealing with the gender issues will always be raised. Now, take a situation where there are more men and women, are very few, and we are being treated like tea girls.
Yeah.
So you find that they have brought the woman right down. Your only position is to serve the tea and to clean and such things. You don't respect what I have, the kind of competence I have. That one is stigmatizing for the woman because you are putting her down back to the cultural expectations, which is not very right. And again, this is another thing that makes a person more vulnerable to burnout than the other. And these are issues that can be dealt with at the workplace. That is why gender mainstreaming was put in place, so that we can be able to deal with both gender, and you give them position of authority. If we have 10 managers, 30% should be women, or 30% should be men, depending on which gender dominates the organization. So again, these are issues that can be dealt with based on the labor law and the policies in the legislations in place, and they can help the other us work with this. So for me, I am saying that the human capital managers and officers, they need to look at the welfare of the employees.
Yeah.
And when they look at the welfare of the employees, they are the voice of the people. It is like a union. The HR and the human capital officer, your responsibility is to advocate for the welfare of the employee, of the people. But when you get compromised and you decided to go with the management because they are the owner of the company or the institution, you sideline the employees, the productivity goes down. Advocate for their rights in terms of mental health and accessing for help. And this is professional help. Giving letters, show cause letters does not solve a problem. You are just making the person more anxious. More anxious. They become the diehards. And you label them within the institution. But if there is a structure as to what is going to be done within the workplace, like awareness program.
Yeah.
That works very well because you can be able to deal with it at a layman's level if you have a wellness program. If you do screening and you find that this person has stress and we are not able to deal with it, this is where we shall refer the person and you take care of it. You refer them and you ensure that they follow through. And your organization becomes more productive because you have taken the welfare and the health of the employees in your hands.
Awesome. I really love that. And I guess for me, this is what this platform is about. You're just so knowledgeable on all topics, especially on the well-being and mental health. And yeah, thanks so much for sharing. Any last parting shots on burnout? I know we've talked a lot about it. Any?
My parting shot is that it does not discriminate.
Yeah.
Burnout can get you anywhere, anytime, depending on what you are doing, how you do it, and how you evaluate yourself. And please, when you are out there and you find that you are stressed, you have burnout, seek professional help. We are out here, we are a phone call away. Just reach out for help, and help is available. Thank you.
Thank you. So that was Dr. Elizabeth. As mentioned, she has been really great support to me personally. So yeah, that was Burnout, the conversation around burnout. Please make sure you subscribe, share, comment. Would love to hear your stories on burnout and how you've dealt with it. Until next time, bye.